Hi, I'm Margaret or Peg Rosenzweig. I am a professor at the University of Pittsburgh School of Nursing. I'm an endowed chair um, in the Glunt Endowed Chair for Oncology Nursing. And I wear many hats here. I'm the Vice Chair of Research in our department, as well as I have a clinical responsibilities. I work as a nurse practitioner at McGee in the breast program, uh, McGee UPMC in the breast program. And I also am the scholar in residence at the Oncology Nursing Society and work with them to develop their research portfolio and priorities and on several research related projects. So the plate is full. I am very interested in palliative care, which I've been asked to speak about today because it really kind of embeds and is foundational to the work that I do. I think that oncology nursing in particular is very geared to symptom science, and in that we pay a lot of attention to palliative care. So, what is palliative care? Sometimes people think of it as, oh, that's end of life care or hospice care, and it's actually not. It's a really critical piece of all healthcare that works on symptom science and tries to ensure that patients, regardless of their illness, really are getting optimal or able to achieve optimal quality of life for them and for their caregivers. It's a supportive, some people describe it as a safety net, and doesn't just focus on symptoms. While palliative care can be very important for symptoms and is often the largest percentage sort of what they do, palliative care also can help patients with communication with providers or can help with care planning, can help a lot with the coordination of care that can be so frustrating and really impact the not only the quality of care, but the sort of distress that patients and families are experiencing while undergoing uh, any kind of, particularly chronic care. I work in the cancer space, and so we certainly have seen palliative care make not only a big difference in quality of life, but there's a lot of literature now that supports the idea that actually it can prolong life to diminish the distress that patients experience, allows them to really focus on the illness itself, receiving the treatments that are so optimal and can extend life. Optimal palliative care also equals longer life, which has been very important and kind of changed a lot of national guidelines because of those findings. We can think about palliative care in terms of hospice care, and palliative care is a part of hospice care, so that when the goals of care are really about comfort measures and a patient does enroll in hospice, of course, palliative care, symptom management, optimal quality of life for patients and families are very important. But it's important to realize the distinction that while palliative care is part of hospice care, not all palliative care is only hospice care. And patients should be aware that this option is available and kind of demanding this for care in order that they do have not only excellent disease care, but that somebody is looking after their well-being in terms of physical and emotional space. Palliative care can be provided at home through home care agencies or through virtual visits. It can be provided in assisted living facilities, traditional nursing homes, certainly in outpatient clinics where you can have a visit intertwined with the person that you're seeing in an outpatient clinic, and in traditional hospital settings as well. So you can, anywhere you are seeking care, palliative care can also be a part of that. So it's not just about physical well-being, it is about the entire holistic approach to patients and families, ensuring that quality of life and distress management is present.